Look, we're going to take you to Sydney now, where an important health story has been developing. So 6 people there have been hospitalised with Legionnaires disease, and it's prompted health authorities to issue an alert to anyone who's been in Sydney's CBD over the past 10 days. For more, Director of the Public Health Unit at South Eastern Sydney Local Health District, Vicky Sheppeard, joins us now from Sydney. Vicky, thank you very much for joining us this morning.
Oh, you're welcome, Emma.
So how are these cases detected in the first place?
Well, people get diagnosed with Legionnaires disease. They gradually develop fevers, cough, shortness of breath. Some of these people have had vomiting and diarrhoea, and after a few days, they usually wind up presenting to hospital, and there's some special tests that can be done at the hospital or by the GP that detects this Legionella bacteria. They have a chest x-ray, it shows they have pneumonia, and it's a notifiable condition. So that's reported straight to us in the Public Health Unit, and when we get a clustering of cases, we start doing an investigation to find out what the source might be. So
what have you found out about the source?
Well, we do know that all 6 of the people were in the central part of Sydney during what we call their exposure period. That's about a week before they became unwell. And 5 of them at least were quite clustered up in the northern part of the CBD, up between Wynyard and Circular Quay. So there's about 500 cooling towers in the city of Sydney, and that's the likely source of their infection, and it's a matter for us working with the city to find out which one of those towers might have the bacterial contamination and to have that cleaned and stop being a risk to other people.
Vicky, can you just explain a bit? I mean, you mentioned the cooling towers, and I know a lot of people will know, but some people probably won't know. How does Legionnaires spread? Where does it come from?
Yeah, so in very large multi-storey buildings, which are very common in cities like Sydney, the air conditioning is usually run not by the little box on the wall that we have at home, but it's a water-cooled system. So this big bath of water sits on top of buildings and contributes to keeping the temperature in the building at the right temperature, but bacteria can grow in that if the bath is not maintained and cleaned, and having chlorine disinfection, and then gusts of wind can spread the little droplets of water out of that water bath, and then the people walking on the streets below can unknowingly breathe in those tiny water droplets, and if that goes into their lungs, they can develop Legionnaires disease.
Vicky, obviously this can be extremely serious. You mentioned people often go to hospital as they get sicker once they've been infected with this disease. You've 6 people have been diagnosed so far. How likely is it that you'll see those numbers grow?
Well, in the past, when we've had this kind of early signal, we have seen more cases in the coming days, and that's one of the reasons we put out an alert, because the earlier someone's diagnosed, the more chance they have of a good outcome. So there's effective antibiotics against Legionnaires disease. So if a person had been in the city and they start to have a fever and a cough and shortness of breath, then they can go to their GP and start getting tested to see if that's the problem, and they can start early on antibiotics to prevent having to go to hospital.
Vicky Sheppeard, thanks so much for joining us this morning, and let's hope that we can get to the source and no more people get sick with this. Thank you for joining us this morning.
You're welcome, Emma.